Hello, everyone. Welcome to another review session with our very good practitioners, from lab. So today we continue with diabetes patterns. This time we focus on ear acupuncture. Okay, mom, tricks. Which point prescription is best for a patient with diabetes manifesting with symptoms in the upper tiao?
Um, Thirst, lung, and endocrine.
Of course, upper tiao, no? So we have the thirst point. You remember where it is? Di ba nito sa
I forgot.
Gallegos? Hindi mo kalimutan mo na. And then the lung. The lung kasi,
The lung.
okay, according to the book I read, if it's the left ear, no? Di ba dalawa yon? Yung nasa taas, that's the opposite lung,
Yes.
sa right lung. Yung sa baba, that's the ipsilateral lung. Okay. Which point prescription is best for a patient with diabetes manifesting with symptoms in the lower tiao?
The bladder, kidney, and endocrine.
Okay, easy. Which point prescription is best for a patient with diabetes manifesting with symptoms in the middle tiao?
Hunger, stomach, and endocrine.
Easy, no? So let's summarize. Upper tiao, thirst,
Mhm.
lung, endocrine, and then
Up,
the lower tiao, UB, kidney, and endocrine.
lower,
Tapos yung middle tiao,
bladder,
hunger,
mm,
stomach, and endocrine. Naku, Ma'am
hunger.
Betty, gawin niyo to Ma'am Betty. Very effective. Lagyan mo ng colored ear seeds. This ear acupuncture point treats acute mastitis and lumps in the breast. There are 2 points total located below the chest point. One point is medial and the other is lateral. What are these?
Mammary
Mammary
glands.
glands. Yeah. I have seen one, mayroon siyang, sino ba yung nagsabi? Oo nga pala. Hindi pala taga rito. Hindi pala taga dyan. The ear point prescription, stomach, liver, spleen, neurogate, or shenmen is used to treat what?
Vomiting.
Yeah. Very easy, no? Kung nasaan si stomach, andun si spleen. So I think you need to always consider uh, needling the spleen when you have the stomach. Okay. And then the liver. Yeah. And of course, the shenmen or neurogate. This ear acupuncture point is located at the intersection of the superior border of the inferior crus of antihelix and the medial border of the helix. Its functions are to treat nervous system
Sympathetic.
diseases. Yeah, sympathetic. Halatang halata. Oh. It is a strong. Oh yeah. So there are three actually, diba? Oh. My favorite there is the one in the middle. Strong analgesic and relaxant effect for relieving pain associated with ulcers, stomach spasms, roundworms in the bile duct, gall, and urethral stones. Dilates blood vessels,
Mm.
treats circulatory and ophthalmological diseases and excessive sweating, an important point for anesthesia. Sympathetic.
Mm.
Which of the following do you prick for fever, inflammation? Oh, okay. Hypertension, revival from hepatic coma, or for analgesic or sedative effect. Use moxa on the point for keratitis. To find the point, bend the ear towards the tragus. Okay. This point can be found at the tip. Oh, binibleed pala yan, no? Piniprick.
Ear
The
apex.
apex, yeah. This ear acupuncture point is at extreme anterior portion at the bottom of intertracheal notch, which is at the base of cavum concha. Its functions are aids in absorption and excretion, anti-allergic and anti-rheumatic functions, gynecological urogenital diseases, dysfunction by digestive system, blood and skin diseases, and malaria.
Endocrine.
Yes. This ear acupuncture point located, this is actually my favorite point, especially mga pain. Located
Mhm.
on the anterior side of the inner wall of the antitragus. It regulates excitation and inhibition of the cerebral cortex, treats inflammation, excessive sweating, pain, insomnia, lassitude, and other neuropsychiatric disorders.
The subcortex.
Yeah, or the brain. Okay. This ear acupuncture point is in the Simba concha, medial to the bladder point. It treats prostatitis, UTI, blood in the urine, painful urination, spermaturia, premature ejaculation.
Prostate. Prostate.
This is used for OB/GYN diseases and sexual dysfunction in men. It is located slightly above the parting of the two crura of the antihelix in the triangular fossa.
The uterus.
Uterus or the prostate for the men. This is in the triangular fossa. Functions, excitation and inhibition of cerebral cortex, sedative, analgesic, anti-allergic effect, used for hysteria and psychosis. Oh, it treats also hypertension, coughing, allergic asthma, itching, and pain. Important point for anesthesia. And
Shenmen or neurogate.
yeah, mas social ang neurogate, no? This ear,
Neurogate.
this ear acupuncture point is located at the prominence of the inferior part of the tragus. So actually, these points are being discussed kasi 'di ba, usually pag diabetic ka, pinakyaw mo na lahat ng mga health issues, 'di ba? Might as well know this thing.
Yeah.
Especially this point, no? Um, this is good for allergies, shock, rheumatism, serious poisoning symptoms from bacterial infection, to dilate and constrict the blood vessels for hypo or hypertension and capillary hemorrhage, to regulate excitation and inhibition of respiratory functions, for fever, certain skin diseases, and chronic illness.
Adrenals.
Yeah, adrenal. Treats eye diseases, acute and chronic hepatitis, iron deficiency. Ay, ito pala for iron deficiency anemia, no? It treats, ay, oo, makes sense. Okay, yung patient ko kasi kanina, mataas yung ano niya, uh, platelets, and she is given blood thinners.
Mm.
Hmm. Ngayon, tinitingnan ko yung relationship
Mm.
ng phlegm. Okay. Now it makes sense. And I had to ask her, were you a little bit matapang before? Tumawa lang siya. She's 68, very successful. Anyway,
Mm.
okay, but she looked younger compared to ano. Nawala lahat yung ano. I would ask her to come every 2 weeks. And then I forgot lang to needle deliver. Oh, Mr. Londoner is here. Okay, wala pang 5:15. It treats arthritic pain, neuralgia, headache, vertigo, stomach pain due to gas in the GIT, hemiplegia, seizures, and muscle spasms. Located in the Simba concha above the left hepatomegaly area. Point,
The liver point.
yes. This treats hemorrhagic diseases. Actually, hindi ko masyado to familiar. The blood point. Are you familiar with this?
The,
Nasa cavum concha sa,
no.
spleen point. Level with the neck.
Below
Ah,
the spleen. Mm,
Yeah.
okay.
Okay. Blood. Yeah, I think I should needle this siguro next time sa aking patient. Located below the trachea point, above bronchiectasis point in the cavum concha. Meron palang bronchiectasis point. Treats hepatitis, tracheal disorders, diseases affecting mesentery or peritoneum and diuretic functions. What is this?
The triple burner point.
Yeah, or the Santiao. Located on the antitragus, medial to stop wheezing point. Gustong-gusto ko yan, stop wheezing, no? Nasa gitna lang. This can relieve itching symptoms of many diseases. What is this point?
Parotid gland.
Okay. On the border of the lower segment of the antitragus, near neck point,
Parotid gland point.
it treats disorders of the cerebral blood vessels and meninges with apoplexy, hemiplegia, convulsions, stiffness along the nape of the neck. It can also treat sequelae of cerebral shock and incomplete development of the brain. Answer?
Brainstem.
Yeah.
Brainstem.
You have to prick this point to bleed to treat hypertension. It is in the trough along the backside of the antihelix on the back of the ear. Ay, ipiprick pala siya, hindi pala hawakan lang. This group is divided into upper, middle, and lower segments. Ipiprick pala siya, so you have to have needle all the time. Gawin ko daw yun. Okay. Your answer?
Lower blood pressure group.
Okay.
Lower blood pressure
Lower
group.
blood pressure group. Okay, located in the superior angle.
The question, can you use the question? Can you use the yung for the yung pang prick sa diabetes sa
Yes.
ear? Di ba
The
masyado
lancet.
makapal yung
Yeah.
needle? Pwede yun.
Oo. Oo. Mas
Oo,
okay.
na lancet pala.
Mas sterile. Di ba?
Okay.
Lancet. Pero
Oo nga.
masakit yun as
Kaya
in.
parang ang kapal ng needle.
Pero para, sabihan mo
Kapal
nga
yung
ako
needle eh.
bumababa. Oo nga. Basta you just have to prick, hindi naman sinabi. Kasi kung hindi mo na, kung ang nipis-nipis, hindi mo prick.
Ah,
So this acupuncture point
oo.
treats hypertension and headaches due to
Okay.
hypertension. What do you call this? Yeah, lower blood pressure point.
Lower blood pressure.
Okay, this is point in section 5. This is also very important. What do you call this point?
The eye point.
Yes. And this one, actually, I needle this. Meron din siyang tinnitus and deafness yung aking patient. If the earlobe from below the intertracheal notch is divided by 3, blah, 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 blah. So this treats oral vertigo, tinnitus, and deafness. What is the point?
Inner
Inner ear.
inner ear.
Section 6. So 1, 2, 3, 4, 5, 6. Okay. Ito. Section 2.
Or wheezing.
No, the tongue.
Yeah, the
Section
tongue.
2 is the tongue. In the triangular fossa between the wheezing and pelvic cavity points.
Hepatitis.
Yeah, hepatitis point. On the antitragus between the stop wheezing and the brainstem points. Used for disease. It is also used for hemorrhaging. The point is
The brain.
the brain.
Point.
Elongated region stretches
The
between
brain.
the point and the inner point on the earlobe. It is used for facial paralysis, spasms of facial muscles, trigeminal neuralgia, and parotitis.
Face area point.
Yes. And finally, section 8. It treats tonsillitis and pharyngitis.
tonsil number 4.
Yeah, madami palang number. Well, thank you so much, everyone, for joining. We will now proceed
Thanks,
to,
Doc.
yeah.